Today, I want to talk about approaches to fatigue. There's a lot of vague symptoms that people will come in with: pain, numbness and tingling, dizziness, nausea all the time, or fatigue being a very common one. And so, what kind of things should we be doing when we're approaching a patient who has fatigue? And now, this will not be like completely comprehensive because there are so many things that can be contributing to fatigue. But I definitely want to think about some common causes that would kind of lead to you wanting to do lab testing and what a good lab panel can look like. And if there's more that you're thinking of as I'm going through this, put it in the comments because we want to add those on and think critically about what all kind of aspects or views can we take of fatigue and what we should be doing for our patients. So I'm going to start with thinking about anemias because I feel like that's kind of an easy catch. If it is anemia, that's pretty easy to fix too, and we like the fixed ones that we can identify quickly and treat. So anemia, there's a lot of different anemias out there, but the three main ones that I would be considering if I was thinking about fatigue would be iron, vitamin B12, and folate. And those are three common ones that have usually like a nutritional source. We can definitely get a lab panel on these, pretty straightforward. You're going to do an iron panel, making sure you're checking, ferritin, for the stored form, transferrin, TIBC, all that. Obviously NH and TIBC, checking a B12 and checking for folate acid levels. So you'll do both a B12 and a B9, and that can get all of your labs taken care of for the anemias. And when you're looking for which one's going to be more likely, you can identify risk factors or root causes in the patient. That would make you lean more, okay, this is probably more of an IDA versus a B12 versus a B9. And so your IDAs are going to be someone who maybe be bleeding from somewhere, who's not getting enough iron from a nutritional source, someone who's having heavy cycles. So those are some of the reasons that we could find, or pregnancy, which is more of a dilutional anemia, but still an anemia. So those are the patients who you can easily treat with iron, and you're going to see it increase in, or decrease in their fatigue and increase in their labs. With the B12, you're looking at a person who maybe had a gastric bypass. Metformin after like 4 years or so can decrease B12. Vegans, just not getting enough in their diet. Those with pernicious anemia. Then with the folic acid, that one's not as common. It's actually really rare to get a folic acid deficiency, but it can happen with people who are not eating enough fruits and vegetables, alcoholics, lactating mothers, and people who have MTHFR gene. And so both B12 and B9 can be affected by those who have an MTHFR gene issue. And so that one's tested by looking at the B12, the B9, and like a homocysteine level. And that's how you can identify those who need a methylated B9 or B12. Definitely want to be checking that if you're getting a low B9 or B12. The next kind of category, moving away from blood issues, would be thyroid function. So we're looking for hypothyroidism because that's the drag down thyroid issue. So you want to get a thyroid panel, TSH, T3, T4. So far we're looking at what are our labs that we're getting: a CBC with diff, iron panel, B12, B9, thyroid panel. And the next thing you want to think about is vitamin D deficiency. Unfortunately, if you look at Americans, if you do labs on them, it looks like everyone's deficient in vitamin D. I had a preceptor who had a lot of opinions about that, and he just thinks that the labs are wrong. He does agree that people aren't going outside as much, definitely are wearing a lot of sunscreen, but he definitely thinks that there needs to be almost an adjustment in the way that we measure vitamin D in patients. So I don't have any sources for that, but I always thought it was interesting that he would talk about how he just thinks that it's kind of wrong that he's like, everyone can't, not everyone. It's like, I have people who are outside all day, not wearing sunscreen, still deficient in vitamin D. He's like, we need to look at what the new normal is and see if this is causing poor outcomes. And it was interesting. But it is definitely associated with fatigue. So if we fix that and check a level, just check a vitamin D level. I mean, so many things are fortified with vitamin D, though. It's difficult to be deficient. It's so weird that we're so deficient in vitamin D. So anyways, what kind of test are you going to do? A 25 hydroxyvitamin D test. That's the best measurement of your vitamin D stores. So again, what are we ordering so far? We're ordering a CBC with diff, an IDA panel, B12, B9, thyroid panel, 25 hydroxyvitamin D. Next, liver function can cause fatigue. We're even looking at things like non-alcoholic fatty liver disease, which is a buildup of fat in the liver. Definitely a cause of poor liver function, liver disease, which can be caused by diabetes, obesity, high cholesterol, triglycerides. Other things that affect the liver, of course, we know about alcohol and certain viruses and autoimmune conditions and things like that. But how do you want to check out these? You want to be getting an AST, ALT, ALP, and bilirubin. Those are all part of a CMP. So you're ordering a CMP. So what are we ordering now so far? We're ordering a CBC, an iron deficiency panel, which includes like iron, ferrous sulfate, and ferritin, TIBC. We're ordering our thyroid panel, B12, B9. If those come back low, you can check a homocysteine level. We are checking a liver panel, and we are checking vitamin D. Our next and last one is if you're looking for like a hormonal cause, you can look for low testosterone levels. It affects both men and women, but we are, specifically thinking men when we're thinking about this one. So testing total testosterone in both males and females, but that is allowed to consider. So test total testosterone. Okay, and so those are some things that I think of when I think of what kind of labs can I order on a patient who tells me they have fatigue. Thyroid is a big one. Anemia is a big one. Those are a lot of your causes. Other causes of fatigue, of course, you're going to do like sleep hygiene. You can even do a sleep diary. There's lots of apps. There's the watches that keep track of your sleep, let you know how often you're waking up. And then another hidden one is obstructive sleep apnea. And that one definitely causes a lot of daytime sleepiness. When you feel like you've been sleeping for 8 to 9 hours, your lab panel's coming back clean, then the OSA, it needs to be considered, especially if they seem to have a floppy, soft palate. The partner in bed says that they are snoring or making lots of noise or seem to stop breathing. Again, lots of daytime fatigue. Obesity does tend to contribute to OSA. So though if you are seeing that kind of combination, again, with kind of a clean lab panel, definitely consider OSA and order a sleep study. Another kind of hidden sign of OSA is dysrhythmias. So if the patient's having chest palpitations or has a dysrhythmia on their EKG, consider OSA. I think that's all I'll say about sleep tonight, mostly focusing on those lab panels. Okay.